Welcome to this month's Public Health Roundtable Live. I'm joined by Dr. Joy. Sometimes we're joined with, up to 4 guests on the roundtable. Today you have the two of us. So we're going to introduce ourselves and then kind of dive into the topic. We're going to be speaking about some of the big challenges that we're seeing around public health, and then some of the solutions, our proposed solutions that we're putting into place that's helping, and then maybe some ideas that we have about, what can be helpful. So my name is Dr. Charlotte Huntley, and I'm the CEO of Dr. C.H. Huntley LLC. It's a public health consulting firm that supports nonprofit, usually large nonprofit organizations, with communicating their health information in plain language. So that could be communicating within departments and between teams, like internally, or it could be helping them to communicate that information, especially the data, to the individuals within the communities that they serve. So it just depends on the needs of the organization. But that's what we do as a group, a team at Dr. C.H. Huntley. I'm also the host of the Public Health Epidemiology Conversations podcast, and we have new episodes every Tuesday. And as I mentioned, our guest this week on the podcast was Dr. Joy. So I'm excited to have her with me on this panel to have the discussion today. So Dr. Joy, you take it away. Introduce yourself for folks who don't know who you are already.
Yes, absolutely. I am Dr. Joyee Washington, but people around the internet just call me Dr. Joy. I am a community health research and education consultant, and I am also CEO of Joyee Washington Consulting LLC. And so our mission is really to revolutionize public health by transforming public health research into positive community impact. And so the ways that we accomplish this is by providing research support. So we provide things like training, technical assistance, and advising as well to community-based organizations, nonprofits, public health organizations. And really what the goal is to implement data-informed and life-changing solutions that bring joy to the communities that we serve. And so I'm also host of the Public Health Joy podcast, which serves as a safe space for us to discuss, what building a public health research career is really like. That could be the triumphs, the challenges, all the lessons that we learn along the way. And so we have new episodes twice a month, every first and third Friday, where we have public health researchers and public health professionals across the spectrum, across disciplines, to come and share their stories and share what brings them joy in the journey.
So framing our discussion for this month, and every month, the first Wednesday of each month, we bring on a conversation. We initiate a conversation around a particular topic, and there are so many challenges that we hear about, that we know of, in public health. We can't address them all. We can't even address all the big challenges. We are just focusing on the ones that we see really often, and that are standing out within the work that we're each doing, and through our clients and our communities, and really highlighting some of those things right now. So I'll start with one myself that I'm seeing, and I've talked about this before, but it just really seems to be surfacing now, and it's around the communication of data. And I almost want to use air quotes when I say data, because I've been having a lot of conversations with leaders in different public health organizations. And some of these are state and federal organizations. Some of these are those large nonprofits that I typically serve. And the challenges around the communication of data is really the understanding of what this data is and what it means to them. Now, as an epidemiologist by trade, and with a lot of experience, I think of something very specific, and I look for the breadcrumbs around data, because the data tells the story. And I understand that not everyone approaches it the way that I do, but that's kind of why I love partnering with organizations, because I come in with this perspective and view. So when I'm having these conversations and they're saying things to me like, there's this challenge of not getting the funding that they need for programs, or they're seeing programs fade away. And they'll say, well, we have the data. And when I ask about the data, or if I go looking for the data that it's maybe front facing or public facing, I see big gapping holes because the data is not telling the story that they need to tell to secure the funding and to sustain those programs. So if the data is not telling the story of this problem or this issue or where we need to have this program or the funding to support, then those things go away. And meanwhile, my clients or community members or individuals I've been talking with lately are just frustrated and they don't understand why these programs are going away or why they're not getting the funding. But when I look at the data, they're pulling and they're sharing data from sources that aren't representing their community. So I don't know if that makes sense, but that has been a challenge for me, and that's where I have how we're addressing it is really rolling up our sleeves to dive in. Number one, realizing that we see it from a different lens. So for me to go and use a lot of, statistical jargon is not going to help that potential client. But I'm trying to say very honestly and openly, here's where the disconnect lies and here's how we can help you, because we can help you generate that data or use the data that you already have and have it tell that story that you need it to tell so that you can advocate for those funds and those sustainable programs that can serve the communities. So that communication piece and how and sometimes it means having multiple conversations with several different groups of people within an organization to get that point across. And it's a bit of a challenge. Sometimes it's, time is money, so you don't know if if one group doesn't get it, then you're ready to leave. But you may need to talk to a few different people before you can to get the right people together to kind of say, okay, this is the problem. Oh, okay, and now this is how we can address it. So I think it all comes down to communication on so many different levels. And so just being able to and being willing to break it down, being willing to have multiple conversations and being willing to, assess yourself and say, am I relaying this as clearly as I think, as I want it to come across, and being able to reach that client. So I'm going to stop there because I could probably go on and on, but that core, thing challenge and is the communication piece, and then addressing is that willingness, that flexibility, that persistence.
Mhm.
So
Yeah, and I think as you are talking about communicating, right, about data, the thing that comes to mind for me, especially in the work that I do, is that communication about data starts with us asking the question, how do we define research?
yes,
And how do we define researchers, right?
absolutely.
Because as we have been trained in research, we've been conditioned to believe that a degree makes you a researcher. A degree does not make you a researcher. Okay.
Absolutely.
So we have to start retraining ourselves to start thinking, who is a researcher, right? And when it comes down to it, someone who is a researcher is someone who asks the questions and someone who seeks the answers. And that means that our community members are researchers. The people who work in our local grocery stores can be researchers. The people, the single moms or the single dads or whatever population you are working with, they are also researchers. So when you're thinking about data, you don't need a degree to collect data or to communicate about data. And so if you start by thinking about who are you as a researcher, how do you view other people as researchers, and how do you define research as a whole? Because what happens is we don't know how to do research in a way that serves our communities well. And so we need to start learning how to do research in a way that prioritizes our community members' needs over our own, in a way that recognizes that our community members have their own strengths and their own capacities. And that's just not how we've been trained. And so when we start thinking about data and how to communicate about data and what research looks like, research is all about critical thinking, right? But we tend not to question research itself. How
Mhm.
did we get here?
Right.
In terms of the method, in terms of the approach. And perfect example, yesterday, the news came out that Henrietta Lack's family, right, had the big settlement, right? We don't have a whole lot of details around it yet, but we know that something happened, right? And we know about the story about Henrietta Lacks and how they used her cells without her consent, had no knowledge, and they've had all these big scientific discoveries, and we've just come a long way in terms of research and science and health and all the things because of her sales, but it wasn't done ethically. It wasn't done morally. It wasn't done with responsibility at all. And so we've arrived at research in this traditional approach, but it's been at the expense of harming individuals and communities and families. And so while yes, we've seen some outcomes from the way that we've been doing research, but then we have to sit down and ask ourselves, is this the best way? Was this harmful in the process? Who did we harm in the process? Was it worth that expense? And so, in my work, I help to address that challenge. How do we think about doing research differently so that we can gather data and communicate data in an ethical way, and in a way that puts our communities first, that prioritizes them, that revolutionizes public health, so that we can bring joy? Because what happened to Henrietta Lacks should never happen. She would have been 103 years old this year. I have a great aunt who is living and is 103.
Yeah.
We think that we are so far removed from this, and we are not.
Yeah.
And this could happen again if we're not careful. History can repeat itself. So we have to make sure that we are doing the work to make sure that we are addressing these challenges head on, so that we are communicating data and using our research skills efficiently, effectively, ethically, responsibly, so that we can see the positive impact that we want to see.
Well said, and timely. I work a lot with Native populations, organizations that serve Native communities, and these are these things, the very same challenges you're talking about come up in daily projects and conversations.
Mhm.
As you work with your clients, your organizations, how are you approaching them, or how do they show up? Are they showing up to you saying, "We know that this is a problem. We don't wanna, we wanna make sure we don't have this issue," or are they even aware of some of these consequences if they're not, making and putting into place some of the, approaches and actions and strategies that you lead with?
Yeah, I would say that it depends, and it
Mhm.
varies across the board, but at its core, people are saying, "I don't know. I don't
Yeah.
know how to do this." And
Yeah.
that's good, and that's great. They're saying, "I know something needs to shift. I know something needs to change. I know that," and I see someone in the comments saying community-based action research. I know that that's a great model, but I don't know how to do it.
Yes.
I don't know how to go about making sure the community members are engaged. I don't know how to make sure that we're doing this the right way. And just
Mhm.
by asking the question when clients come to me, I am so grateful. I'm like, "Thank
Mhm.
you for saying I don't know.
Yeah, yeah.
Thank you." Because now we can figure some things out, and we can move forward. And community-based research, community engaged research is kind of like a hot word right now,
Yeah, yeah.
right? Kind of like how health equity was a buzzword, hot word,
Yeah.
diversity, equity, inclusion was a hot
Right.
phrase. But are there people who are really doing the work and really applying these things to see that positive impact? And that there are. There are people who are really doing this work, and there are people who are using these as buzzwords. And
Yeah.
there are people who are saying, "I hear these words, but I don't know what they mean, and I don't know how to apply them." And so that's a challenge, that you seek someone who has
Mhm.
had the experience to really learn and who has applied these methods. Community-led research, community-driven research even goes beyond community engaged and
Yeah.
community-based research. And so it can drive so much more impact. And we can't do anything. Our research is nothing without the people, without the
Yeah.
community members. And they have to be actively engaged and participants of the process if we really want to see true positive impact.
It really explained how we serve as consulting organizations, as consultants, right? So we have organizations that understand this is, we want to be more involved with the community. We understand that we can't, we need the community engagement, community-led research, community participation. We understand we need that. Then we've got, and then they get a little segmented. We've got the one camp that is, okay, this is exactly how it's going to be done, because from a purely by the book list of how it should be done. Step 1, 2, 3, we're going to accomplish this. This is our objective. We're going to accomplish this. And they just want to, this is how we're going to do it, with no practical application, no flexibility, no thought to involving the community in how we conduct this. They're saying this is how it should be done because maybe it's a policy or a textbook definition or outline or flow that says this is how it should be done. But what's missing is that element of involving the community to really see how it should be done. Then we've got this camp over here, which is like you said, they show up like, yes, we want this community involvement. We want this to be for the community, by the community. We want to work with the community, but we have no idea how to do that. And I agree with you. When they show up that way, I love it because that's where, as a consulting organization, I come in knowing exactly what my expertise, my skills like. They may say, we want this deliverable. We want to make sure that this fact sheet or this one pager or this slide presentation is going to inform the community. We want to make sure that they understand what we're expressing and explaining so that they can then make the decisions that are best for them at the end of the presentation after reading through the document. And I'm like, yes, I understand. I get it. Thank you for coming to me with that. But they don't know how to put it together. They just know that's what they want to happen at the end. And then I know how to pull that data. I start pulling it together. And then you get the community involved. You have to understand who the community members are so that we're presenting deliverables and talking a language that they understand that's representing them. And you can only do that by getting them involved.
And even more so when people come to me, the first thing out of my mouth when it comes to research is I'm like, how are you building relationships?
Yes.
What does this look like for your community? How tied are you to this community? How are you participating in the life activities of your community? Do you know this community at all? And sometimes they do and sometimes they don't, and it just depends. But if you are not taking the time, if you haven't taken the time to build those relationships, we got to come up with a strategy to do that first. That's the first thing we got to do before we do any kind of research. You got to have some relationship building. And a lot of times people are either they don't know that that's a step or they're skipping over that step entirely and then wondering, well, why can't we get the community engaged? Why doesn't the community want to participate with us? And it's like, we need to take a look at your relationships.
I mean, we all know, right? When someone approaches you, you can sense the sincerity and if they're genuine or, or if they're just, if they just want something from you, right? Any community, it's exactly that way. If you just go storming in with your fancy company or organization information and you're forcing it at people or your agenda, the wall goes up instantly. It's like
Mhm.
we sense that. As much as I love the use of technology and I love the easy access that we have to things and the ease of, gathering and sharing information and so forth, we can never forget that human connection. We need to prioritize always the relationship. I was on a call just a little while ago. It was one of, introductory call. So I'm getting to hear about, their organization and their needs. I'm sharing about, what I can do and resources. But we also talked on a very personal level to get to know each other. We found out we each have a child that went to the same college. You know, we need to get, we need to have relationships before you can ever have any kind of impact. We have to have relationships, with the community, have some connection. Even if you're not, you may not necessarily shake hands with every individual within the community. That's not the same thing. But when you have a relationship with the community, then whatever your deliverables are, they're going to feel it. They're going to know it when they read the document, when they see a slide, they see a photo, they touch, whatever that deliverable is.
And just knowing that, these are not just subjects, these are not just
Yeah,
participants, right? These
exactly.
are people with their own lives, with their own stuff going on. So if I have to conduct a phone survey and I'm calling Miss Sarah, I don't just pick up the phone and say, well, Miss Sarah, it's time to do your interview today or do your survey today. I need you to answer these 10 questions, strongly disagree to strongly agree. Tell me 1 through 5. There's no relationship there. I
All
have to
right.
say, Miss Sarah, how you doing today? Did you get to
Mhm.
I know I talked to you the other day. You were gonna go to the grocery store. Did you get your chicken from the grocery store? I remember you told me how good that chicken was. How was it? How's your daughter doing?
That is
Care
yeah.
about the things that they care about, and that will open the door to build trust and relationship. And then Miss Sarah won't have an issue saying, "Oh yeah, baby, I'll go ahead and answer those 10 questions. I appreciate you for asking," and whatever, whatever. But you have to start with where they are.
Absolutely. Relationships are first and primary. They need to be prioritized. That's just the general public health message right now, right? Before you can even get to community, you have to work on the relationship part. That's like the precursor.
When it comes to public health or public health research or data, just make sure you're prioritizing relationships, and not just relationships with your colleagues, with your peers, but with your community members. Because if that is a challenge for you, then if you're addressing it head on and right at the front of things, then that's going to lead you to some big solutions. Trust and relationship can be a huge solution when you're dealing with any kind of challenges regarding public health or public health research or data or anything like that. Start with relationships first.
Thank you for summarizing that. I feel the very same way. And just well said. I think for all of us, we can just pause and take a moment about, maybe do a little audit on some of the relationships. And we have to do things differently. Right. So even if you think, well, my relationships are good. I mean, that doesn't mean there's no room for improvement. There may be some things that you can adjust and tweak and make it, improve upon. We need to invite more creativity and reflection and into public health and all of the work that we do. It doesn't matter if you're an entrepreneur, if you're the employee, we need to be doing things differently. And that's about building relationships, having conversations with people, exploring ideas and thoughts,
Mhm.
getting to know what your colleagues are doing. All of that's rooted in relationships. So, and we're committed, both of us. I know we're committed to this mission of public health. So those of you that are connected with us, be prepared to be inspired and because that's just that's how it is. So we're here for the long run. So there are two areas that Dr. Joy and I have been talking about kind of off camera behind the scenes, and we're working on right now. And I just want to share with all of you to get you thinking, to make sure that you are aware it's coming. Two areas that we really want to focus on in upcoming conversations, whether it's on a live on LinkedIn or however we decide to do that. But one is really pouring into students. We both agree that our next generation of public health leaders are right now students. And maybe they're already focused on public health, or maybe they're exploring, they're curious about public health and they're trying to explore and decide. We really want to, both of us have had a start in pouring into communities or students, when with our podcast, with our consulting journeys. We always make time to pour into students in different pockets and places. And this is a time that we really want to come together and serve the students, really help address some of their questions, inspire them, hear from them. And this is kind of on the tail end of an event that I attended last week that really got me going. I had an opportunity to serve in a small window of time on a panel for an hour, and then the next day I engaged as much as I could. And it reminded me of their questions, and the engagement reminded me of just this need for this ongoing guidance. And some of it's just kind of pointing them to resources that we've created in the past that exist. So we're making some space to really share more with students. And I think as we wrap up the summer and starting with this new term, in this next fall term, is a great time for us to be able to do something. And then also in the space of podcasting, we're both podcasting is a very important part of our business and our foundation and this community, how we build community and connect with folks. And there are a lot of other good podcasts out there, some other public health focused podcasts. And a lot of you are thinking about it from the perspective of, I don't know, maybe I will start a podcast. And then some of you like podcasts, but don't really know of some of the other shows that are, good options to listen to. So we're looking to put something together where we can have a topic that's kind of focused on podcasting. And so those are two areas, focusing on students and really podcasting. It's an incredible platform, an option for us to leverage in our businesses or individually. So we are looking to host something specifically on those two topics coming soon. So if you're following us, you'll get the notice and announcement once we put it all together. So that's another incentive and reason to be connecting with us. Thank you, Dr. Joy.
Well, thank you for having me.
Absolutely fun. All right. Thank you all for joining, those that joined live and watching the replay. And remember to share this with your network so that other people can have the opportunity to join in this discussion in the comments and be a part of this conversation. We'll see you next month.